My name's Aiden Doherty and I'm a Senior Research Fellow at the University of Oxford in Population Health Epidemiology and Biomedical Engineering. What is population health epidemiology? Well, it focuses on the causes of diseases such as cardiovascular disease, where we ask people the types of lifestyle behaviours they do, such as physical activity, and we follow them up for many years to see who develops cardiovascular disease and who doesn't. And within that, traditionally, we have asked people how much exercise they do, for example, rather than objectively measuring it. My research focuses on using new devices, such as wrist-worn accelerometers and wearable cameras that take first-person point-of-view images. These devices capture a lot of data. For example, we would take many tens of thousands of pictures per week and many hundreds of millions of movement readings per week from the accelerometer. For example, when a person goes to work on the accelerometer trace, we can see high motions for when they might be walking or cycling, and then when they get to the office, we see not so much motion. And the camera data is incredibly helpful to verify with the person whether they're walking or cycling. So these data sources complement each other very well and helping us understand the types of lifestyle behaviours people are engaged in. And how does my research contribute to this field? Well, I developed data processing techniques to reduce these many hundreds of millions of sensor readings into something that is meaningful and useful for health researchers. For example, time people spend asleep or awake or being physically active. And from this then, we can follow many hundreds of thousands of people in epidemiology studies to see who develops cardiovascular diseases or cancers. In terms of my specific contributions to this field, if we consider previously it might have taken around 18 to 20 minutes to process just one person's data, that means it would have taken 3.5 years to process the UK Biobank data set, which follows 100,000 people, which I contribute to. I've developed new data processing techniques to reduce the time to process this data set from 3.5 years down to just a matter of days through exploiting my previous background in computer science. I was fortunate to receive a Marie Curie fellowship, which helped me then segue into medicine and specifically population health epidemiology here at Oxford. So the combination of my computer science background and the population health epidemiology here in Oxford has helped me set up a new program of research at the intersection of medical sciences and computer sciences. In terms of my own personal career, it's helped me gain another fellowship from the British Heart Foundation and, in addition, a Stanford and Oxford Big Data and Health Initiative. Using technologies and data processing methods such as those that I'm developing, it can help inform clinicians as to how much exercise particular patients are doing, which is very important in terms of preventing future cardiovascular disease.